Hey, welcome. Our voices are amazing tools, right? We use them to communicate every single day. But what if I told you they're also sending us messages, really important messages about our health? Today, we're going to play detective and decode some of those signals. So let's jump right in with a sound we probably all recognize.
I mean, we've all heard it, haven't we? That super deep, raspy voice that you just immediately connect with long-term smoking. But have you ever really stopped to think about what is physically going on inside someone's throat to make that exact sound? It's definitely more than just a bad habit leaving its mark.
The sound we call a smoker's voice is actually the direct result of a physical transformation happening to the vocal folds. It's a pretty dramatic story, really, all about irritation, inflammation, and how the body tries to deal with some serious long-term trauma.
So let's peel back the layers and uncover the science behind that signature sound.
Okay, so the main culprit here has a name, Rinke's edema. To really get this, I want you to picture the very top layer of your vocal folds. It's super delicate, and it's the part that vibrates to make sound. Now, when that layer is constantly irritated, most often by smoke, the body goes into defense mode, and its response is to fill that layer with a thick, almost gel-like fluid. This isn't a minor thing. It fundamentally changes the entire structure.
And this condition, it's a spectrum. When it's in a milder form, we call it Rinke's edema. But if that irritation keeps going, it can progress into something way more severe called polypoid degeneration. And at this point, the vocal folds get so swollen with that thick fluid that doctors have actually described them as looking like enlarged fluid-filled bags, or get this, the ears of elephants. Just wild.
So how does this physical change create that specific sound we all know? Well, all that extra mass and fluid makes the vocal folds vibrate way, way slower, and that's what gives you that dramatically lower pitch. The swelling also means they can't close properly, so you get this little air leak, which we hear as that classic husky, dry hoarseness. Put it all together, and you've got that iconic whiskey or smoker's voice.
And this brings us to an absolutely crucial point. A specialist can look at someone's larynx and see this damage with their own eyes. So even if a patient says, "No, I don't smoke," the presence of severe Rinke's edema tells a very clear, undeniable story. It's like they say, the larynx just doesn't lie.
So how do you fix it? Well, the path to recovery has one step that is completely non-negotiable. You have to eliminate the irritant. You just can't heal the vocal folds while you're still doing the very thing that's damaging them. After that, voice therapy can really help, and for the most severe cases, surgery is often needed to get rid of all that fluid buildup. But seriously, without that first step, nothing else is going to work.
But, smoking isn't the only bad guy here. Next up, let's look at a whole different issue, one that's caused by a different kind of pressure, both mechanical and chemical. Let's talk about granulomas.
Okay, so this is a contact granuloma, and right away it's different. Unlike Rinke's edema, which affects that vibrating edge of the vocal folds, these guys typically show up at the very back of the larynx, on the cartilages. They're these little inflammatory vascular lesions, which just means they have blood vessels, and they are a direct response to something irritating that specific spot.
And what could be causing that irritation? Well, it turns out it can happen in three very different ways. First, it can be mechanical pressure, like from a breathing tube rubbing against the tissue during a surgery. Second, it can be chemical irritation. We're talking stomach acid from severe acid reflux literally coming up and burning the back of your throat. And third, and this is fascinating, it can come from how you use your voice. Specifically, speaking in a really pressed, low-pitched way that creates constant tension right on that one spot.
Now, here is the key symptom, the thing that really sets this apart. While a lot of voice problems just make you sound hoarse, the number one signal for granulomas is pain, a sore throat that just won't quit, or sometimes a pain that feels like it's shooting up toward your ear. And here's the kicker. This can happen even if your voice sounds perfectly normal, because the lesion isn't on the part that vibrates.
So far, everything we've looked at is the larynx reacting to some kind of external irritant. But what if the problem isn't something that's happening to the vocal folds? What if it's built right into their very structure? Let's investigate a totally different kind of defect.
This is called a sulcus vocalis. This isn't a swelling or a lesion, it's a structural flaw. The best way to think of it is like a little groove, a furrow, or even a pocket that runs right along the edge of the vocal fold. This groove messes up the nice smooth surface, which stiffens the tissue and, really importantly, prevents the vocal folds from closing all the way, leaving a gap.
So where does a sulcus even come from?
Well, the truth is, nobody is 100% sure, but there are two main theories. One is that it's congenital, meaning you're just born with it because of a little hiccup during development. The other idea is that it's acquired, something that develops later in life, maybe as scarring after a surgery, or just from changes related to aging.
And this, unfortunately, is where the story gets pretty tough. Because the sulcus is a structural defect. It's a lack of tissue, not an excess of it. It is incredibly difficult to treat. Voice therapy can help someone learn to use their voice more efficiently with the sulcus, but it can't physically fill in that groove. And surgery? People have tried, but honestly, it has very, very limited success. So after looking at all these different cases, from the massive swelling caused by smoking, to lesions from pressure, to an actual structural flaw, what's the bottom line? What should we really take away from all this?
So, what have we figured out? Well, for one, your voice is like a direct barometer for what's going on in your larynx. We've seen that habits like smoking cause real physical damage. But we also learned that irritation can come from all sorts of things: acid, pressure, you name it. And maybe most importantly, that sometimes a voice issue isn't about your behavior at all, but about your anatomy. The biggest takeaway, though, is this: if you have pain or hoarseness that just won't go away, that is your body sending you a signal, and you really shouldn't ignore it.
We've seen today just how clearly our voice can signal what's happening deep inside our bodies. It really makes you wonder, doesn't it? If your voice is just one signal, what are all the other messages your body is trying to send you every single day?